The arrival of several new vaccines for COVID-19 is bringing hope in the new year. But for those recovering and suffering from what some have labeled long hauler syndrome, it's been an uphill battle. No one seems to have definitive answers about the exact road back to normal after a COVID diagnosis. So, in tonight's Rebound Detroit, we searched for the top expert studying the unknown. The mysterious COVID-19 virus arrived on the shores of America a year ago. But now, for many who contracted the virus and survived, the symptoms are lingering.
I can stand for about 5 minutes. Other than that, I get out of breath.
Jim Taylor, a family man, used to work 70 hours a week. But COVID landed him in the Detroit Medical Center's intensive care unit on a ventilator. Life forever changed. Jim is what some call a long hauler. 10 months after diagnosis, leg pain, sleep apnea, and depression remain.
I take about, 12 pills a day.
Do they have any answers for all of these symptoms, or they're just saying?
Nothing.
Like Jim, LaTanya Carter still suffering after a March diagnosis.
All of these pains and with serious fatigue.
CNN's Chris Cuomo talked about his struggles on air. Actress Alyssa Milano shared her shocking hair loss on YouTube. And there are online support groups. The unifying theme?
They feel abandoned, unfortunately, that no one believes what they are going through.
Dr. Greg Vanishkashorn of the Mayo Clinic is one of the few I could find studying what he calls post-COVID syndrome.
You know, I wish there was a silver bullet that we had for post-COVID syndrome at this point, but there really isn't one yet.
So what are the main symptoms that people need to be worried about?
The most common symptom that we are seeing is fatigue.
But it's severe. A 4-hour nap needed after doing dishes, walking, or getting the mail. Shortness of breath and brain fog also common.
Is there a reason some patients will take longer to recover?
Individuals who have been in the hospital or treated in the ICU, they seem to have longer courses for the post-COVID syndrome.
Jim was sent to the DMC's COVID rehab program at the Rehabilitation Institute of Michigan in Sterling Heights.
He was walking with a walker. He had a lot of problems with pain.
2 days a week has helped.
He has improved in his breathing, his endurance. He no longer walks with a walker.
Dr. Vanishkashorn says 2 to 3 months of acute therapy is usually enough, but for others, it takes 6 months.
So I do think that there's an end in sight. Certainly, some folks will have long-term problems.
Jim's biggest fear, never being able to work again.
I, went from working full-time, sometimes 70 hours a week, to nothing.
And so this has the potential to be a very serious concern for our economy.
And no one is immune.
Again, marathon runners, pilots, but also individuals who have a lot of chronic medical conditions.
So how long do you think it will take to have definitive answers?
Probably in the next 3 months, we're going to know a lot more about post-COVID syndrome.
So here's the Rebound Rundown. You are not alone. This is a real condition. Reach out to your healthcare provider for where you should go next if you are not getting better. And know it will take time to recover. Dr. Vanishkashorn says they are poring over research out of London and Italy, trying out new medications, and he believes they will have more answers by spring. So they're researching it, and hopefully we'll know, because Dave, this is brand new.
Well, it sure is, and the sooner we get those answers, the better.